I want you to imagine a beam of light. And, not just any light, but a beam so intense and just so incredibly concentrated that it can instantly vaporize human tissue.
Right, which sounds totally like a weapon out of a sci-fi movie.
It really does. But this exact same beam of light is precise enough to, say, erase a single fine wrinkle around your eye, or even seamlessly carve out an inflamed ingrown toenail without shedding a single drop of blood.
Yeah, it represents this incredible paradox in modern medicine. I mean, we are looking at a tool that harnesses just profound raw destruction, but it applies it with such pinpoint microscopic accuracy that it literally forces the human body to heal itself.
And what we're looking at today is the carbon dioxide, or CO2, laser. Welcome to this deep dive.
Glad to be here for this one.
So for our stack of sources today, we're pulling from a pretty wide array. We've got clinical guidelines from the British Association of Dermatologists, patient leaflets from the NHS, a regulatory paper from the British Medical Laser Association, and several peer-reviewed journals on laser surgery complications.
It's a really solid stack.
Yeah, and the mission for this deep dive is to demystify the CO2 laser. We really want to separate the cosmetic hype from the actual medical reality and explore this fascinating tightrope between, profound healing and severe injury.
Because it really is a tightrope. I mean, if you've ever wondered how just shining a light on your face can physically alter your cellular structure, well, it's not magic, it's just physics.
Exactly. And before we get into the cosmetic and medical applications, we really have to understand that mechanism.
Right.
So back in 1964, a physicist named Kumar Patel invented the CO2 laser. And it emits light at a very specific wavelength, which is 10,600 nanometers.
And if you're wondering why that specific number actually matters, it all comes down to how light interacts with biological tissue. It does this through these targets that we call chromophores.
Right, chromophores.
Yeah, a chromophore is basically just the part of a molecule that absorbs a specific wavelength of light. So if a wavelength doesn't have a matching chromophore in the tissue, the light just scatters, or it passes right through without doing much of anything at all.
Which is why different lasers target different things, right? Like,
Yeah.
if you were doing laser hair removal, the laser is calibrated to target melanin, which is the dark pigment in the hair follicle.
Exactly. Or, other lasers target hemoglobin in the blood to collapse spider veins. But the CO2 laser, it completely ignores your pigment. It ignores your blood. At 10,600 nanometers, its absolute primary target is water.
Which means it's targeting essentially everything, because human soft tissue is composed of, about 70% water?
Yeah, right around there. So when that 10,600 nanometer beam hits the skin, the water inside those cells just absorbs the energy completely. The temperature spikes to 100 degrees Celsius in just a fraction of a millisecond.
Wow.
The transition from liquid to gas is instantaneous. The water expands into vapor so rapidly that the tissue is literally fragmented and vaporized.
And in medical terms, that's what they call ablation, right?
Yes, exactly. It's ablated. The physical structure of the cell simply ceases to exist in that spot. But the mechanism that makes this highly prized for skin rejuvenation, it isn't just the vaporization itself.
Right, it's what happens around it.
Yeah, it's what happens to the tissue sitting just outside that immediate blast radius.
The tissue that doesn't get vaporized but gets hit with the peripheral heat wave.
Yeah.
I kind of think of it like putting a microscopic cup of tea inside a microwave. The center boils instantly and vanishes, but the ceramic cup, or in this case, the surrounding skin structure, gets incredibly hot.
That is a great analogy. And that peripheral heat causes a process called collagen denaturation. You see, your skin is supported by this structural framework of collagen proteins.
Right.
And under normal conditions, collagen has a very specific three-dimensional helix structure. But when that sudden wave of thermal energy hits it, the heat breaks the bonds holding that structure together.
So the proteins just unravel.
They unravel, they lose their shape, and they immediately contract.
So you get this instant tightening effect just from the heat shrinking the existing collagen fibers.
Yes, but there is a secondary, longer-term biological response too. Because we are inflicting a controlled thermal injury, the body's immune system detects this damage and interprets it as this massive distress signal.
Like, we're under attack, send help.
Exactly. It responds by flooding the area with fibroblasts, which are the cells responsible for building brand new, healthy collagen. So the biological consequence of that immune response is that over the next, say, 3 to 6 months, the body lays down a completely new architectural foundation for the skin.
So you are physically removing the old, damaged tissue and then using that thermal trauma to trigger a profound regenerative cascade.
You nailed it. And because it is so effective at targeting water, the CO2 laser became the ultimate tool for what dermatologists call fully ablative resurfacing.
Right, ablative, which means taking the surface off.
Yeah. If you look at the current clinical guidelines for treating severe photoaging or deep wrinkles or really extensive acne scars, ablative resurfacing is where you bring out the big guns.
Because the laser is used to meticulously strip away the entire outer surface of the skin,
Yeah.
the whole epidermis in the treated area.
It's the absolute gold standard for profound skin damage. Because, while topical creams or chemical peels might induce some superficial turnover, they just cannot reach the deep dermal layers.
Or physically vaporize scar tissue.
Right. They can't do that with the micron-level precision of a laser. I mean, a chemical peel is essentially a controlled chemical burn, and controlling the exact depth of penetration with chemicals is incredibly difficult.
Whereas the CO2 laser gives the practitioner absolute mechanical control over exactly how much tissue is removed.
Exact.
But looking at the recovery protocols in our sources, the reality of fully ablative resurfacing is honestly brutal.
Oh, it really is.
Because when you strip away the entire epidermis, you are removing the body's primary barrier. The clinical literature outlines a recovery involving severe oozing, crusting, and just raw skin for 7 to 14 days. Your face is essentially weeping serum, because there is literally no outer layer of skin to hold the fluids in.
It's intense.
And even after the barrier reforms, patients are left with bright pink skin for months due to the ongoing inflammation and that collagen remodeling we talked about.
Yeah.
So I have to ask, if the recovery is so grueling, with weeks of oozing skin and high risks, why would anyone ever choose this over gentler skin creams or peels?
Well, the intense vulnerability of the skin during that period definitely carries significant risks. Like the thermal trauma can easily reactivate dormant viral infections, particularly the herpes simplex virus.
Oh, wow, so cold sores.
Severe cold sore outbreaks across the raw tissue, yes. And it can cause massive acne flares. Plus, there's the risk of permanent pigmentary changes, either hyperpigmentation, where the skin heals too dark, or hypopigmentation, where it loses color entirely because the melanocytes were permanently destroyed.
Right, so it is an extreme, high-risk, high-reward scenario.
Exactly. You get the most dramatic rejuvenation possible in a single treatment, which is why it's the gold standard. But you also have to hide in your house for weeks while your face oozes and scabs.
The downtime is just entirely unmanageable for the average person.
Right. So the industry needed a way to get the thermal contraction and the collagen production of the CO2 laser, but without, stripping off the entire face.
And that necessity drove a massive technological breakthrough in 2004, which is known as fractional photothermolysis.
Yes. The concept shifted completely away from treating the entire surface area. Instead, engineers developed a way to take that solid beam of light and fractionate it. They basically divided it into thousands of tiny microscopic columns.
So rather than a solid wall of light hitting you, it functions more like a shower head, right? Punching thousands of microscopic holes into the skin.
That's a perfect way to picture it. And these holes are called microthermal zones, or MTZs. The brilliance of this approach really lies in the biology of wound healing. Because the laser only targets a fraction of the skin, maybe 20 to 30% of the surface area, each of these microscopic columns of vaporized tissue is completely surrounded by bridges of intact, healthy, untreated skin.
Okay, so the standard analogy you usually hear for this is aerating a lawn, right? Punching holes in the dirt so it grows back better. But looking at the cellular mechanism, a better way to visualize it might be a highly controlled forest fire.
Oh, I like that.
Yeah, if you burn down the entire forest, which is fully ablative resurfacing, it takes decades for the ecosystem to rebuild from scratch because all the local resources are gone. But if you burn a meticulous grid pattern into the forest, leaving rows of mature trees completely untouched, those surviving trees can immediately drop seeds and supply nutrients to rapidly repopulate the burn zones.
That's exactly what happens on a cellular level. The healthy keratinocytes in those untreated bridges immediately migrate into the microthermal zones. They seal the microscopic pillars of damage in a matter of just 24 to 48 hours.
Wow, that fast.
Yeah. So the clinical result is that you still get the profound collagen contraction from the peripheral heat, but the downtime plummets from several weeks down to just 5 to 10 days. You bypass the severe oozing and scabbing phase almost entirely.
And because you aren't removing the entire protective barrier of the skin, practitioners can dial up the energy and drive those fractional beams incredibly deep, right? Some protocols reach over 2 millimeters into the dermis.
They do, and that depth allows for structural remodeling of deep surgical scars. It also opened up the ability to treat areas off the face, because the skin on the neck, the chest, the hands, and the arms is much thinner and has fewer sebaceous glands, which means it heals much slower. Fully ablative resurfacing in those areas carries a massive risk of permanent scarring. So fractional lasers made it safe to rejuvenate those delicate areas. We even see it used prophylactically now.
What do you mean prophylactically? Like preventing scars?
Yeah, treating surgical incisions like after a thyroidectomy very early in the healing process, just to prevent raised hypertrophic scars from forming in the first place.
That is incredible. And, while the cosmetic and anti-aging applications always dominate the conversation, the medical literature shows the CO2 laser is an absolute workhorse for treating serious non-cosmetic conditions, too.
Oh, absolutely.
It acts as a highly specialized delivery mechanism. Take vitiligo, the autoimmune condition where the body attacks its own pigment cells, leaving white patches on the skin.
Right, and treating non-segmental vitiligo, especially on really stubborn areas like the hands and feet, is notoriously difficult.
Yeah.
But current clinical guidelines highlight a fascinating application where the fractional CO2 laser is used to punch those microscopic MTZs into the depigmented skin.
But not to burn the skin away, right?
No, not at all. It's to create physical channels. A topical medication called 5-fluorouracil is then applied.
So the laser basically creates the tunnels so the drug can bypass the stratum corneum and penetrate deep into the tissue to suppress the local immune response.
Exactly. It's a delivery tunnel.
Though we should note, for you listening, if you are reading up on this, the British Association of Dermatologists guidelines are very clear that combining CO2 lasers with potent steroids and narrowband UVD light is not currently recommended due to a lack of solid clinical evidence for safety and efficacy.
Yeah.
We just want to impartially pass along what the medical sources state.
Yeah, that's a crucial distinction. And moving into podiatric surgery, the mechanism of targeting water makes the CO2 laser indispensable for severe ingrown toenails.
The toe surgery, this blew my mind.
It's brilliant. When a surgeon needs to perform a wedge resection, which is removing a section of the nail, and the chronically inflamed tissue surrounding it using a traditional steel scalpel results in a highly vascular, bloody field.
Those bleed a lot.
They really do. But when you use the CO2 laser as the scalpel, that peripheral heat wave we talked about earlier instantly coagulates the proteins in the blood vessels. It seals the capillaries shut the literal millisecond it cuts them.
So you end up with a virtually bloodless toe surgery, which gives the surgeon perfect visibility.
Unmatched visibility and precision. But the physics of rapid vaporization introduce a pretty significant hazard when we look at treating viral lesions.
Yes, specifically common and plantar warts.
Right. The laser is incredibly effective at vaporizing the thick, hyperkeratotic tissue of a wart down to the normal cellular architecture. The problem lies in what happens to the actual virus itself during that process.
And this is one of the most alarming details in the clinical safety guidelines. When the laser hits the wart, the 100-degree cellular water boils, and the tissue explodes into steam. That steam creates a laser plume.
Which is a visible cloud of smoke that fills the room.
And that smoke contains active, viable human papillomavirus DNA.
Yeah. The rapid phase change from liquid to gas happens so quickly that the thermal energy doesn't even have time to fully denature the viral proteins. The cell wall ruptures from the internal steam pressure, and the solid particulate matter inside, including the intact viral DNA, is blasted outward.
Wait, really? So it literally hitches a ride on the steam and aerosolizes into the operating room?
It does.
So the practitioner is standing there, essentially creating a cloud of contagious wart virus. And standard surgical masks do not filter out particles that small.
No, they don't.
So without specific precautions, both the surgeon and the patient are actively inhaling HPV, which can lead to developing warts inside the respiratory tract.
Yes, which is exactly why this dictates absolute adherence to safety protocols. A dedicated smoke evacuator, which is a high-powered medical-grade vacuum with specialized ULPA filters, absolutely must be placed within 2 inches of the surgical site. It has to pull the vapor out of the air the exact millisecond it leaves the skin.
Wow. The terrifying reality of breathing in aerosolized viruses perfectly sets up the darkest side of this technology. I mean, we've established that the CO2 laser is a 10,600 nanometer beam of pure destruction that aggressively targets water. So what happens when this beam gets anywhere near the human eye?
The ocular risks are just profound. The medical literature on cosmetic laser injuries presents a very grim picture. The eye is incredibly vulnerable for several physiological reasons.
Right.
First, the skin of the eyelid is the thinnest anywhere on the human body. It provides almost zero thermal insulation. And furthermore, the internal structures of the eye, particularly the retinal pigment epithelium and the cornea, are highly hydrated.
Right, full of water.
Exactly. So they will eagerly absorb that stray laser energy.
And your instinct is to think, well, just keep your eyes tightly closed during the procedure.
Hmm.
But the anatomy actually works against you here due to a reflex called Bell's phenomenon.
Yeah, Bell's phenomenon is an involuntary defensive reflex. When you forcefully close your eyelids, your eyeballs naturally roll upwards and slightly outward inside the socket.
Which means, by tightly closing your eyes, you are physically rolling your cornea, your iris, and your retina upward, placing them directly behind the upper eyelid,
Yes.
which is the exact thin, vulnerable tissue the practitioner is trying to laser to remove wrinkles. You're putting the most critical parts of the eye right in the line of fire.
And the resulting injuries documented in the literature really reflect this vulnerability. In studies analyzing cosmetic laser eye injuries, over 60% of the patients who suffered damage were either not provided with protective eyewear or the eyewear was intentionally removed during the procedure
Why would they remove it?
to allow the practitioner to treat the skin closer to the lash line.
Oh, no.
Yeah. And the outcomes include severe iris atrophy, irreversible cataracts, and permanent visual field defects. We are literally talking about irreversible blindness.
But the most shocking statistic involves what happens when practitioners actually follow the rules. Even when doctors placed protective, medical-grade metal shields directly over the patient's eyeballs, they look like large metal contact lenses. 33% of the reported ocular injuries still occurred.
This is known in the field as the shield paradox. Now, the metal shields are entirely opaque, right? They perfectly block the laser light from hitting the eye.
Wait, but if metal is a conductor, and you are blasting a steel shield with the heat ray, the shield absorbs that thermal energy.
Yes.
You're just turning it into a frying pan. You aren't blinding him with the laser light. You are physically cooking the cornea with the protective gear.
It is terrifying, but the physics of heat conduction cannot be ignored. If a practitioner fires the laser repeatedly over the thin eyelid skin without pausing, the continuous thermal energy transfers directly through the tissue and intensely heats the metal shield resting on the eyeball underneath.
Wow.
The shield becomes a branding iron, causing severe thermal burns to the ocular surface.
Which is why the strict clinical protocols demand that practitioners take frequent breaks, use active cooling devices, and apply cold packs to the metal shields between laser pulses to constantly pull that heat away.
Exactly.
It requires a deep fundamental understanding of thermodynamics, not just knowing which button to push on a machine.
And this brings us to the critical issue of regulation. The UK's Department of Health and Social Care has been developing a tiered risk system for non-surgical cosmetic procedures. Regulatory bodies like the British Medical Laser Association have submitted extensive frameworks emphasizing that laser and intense pulsed light treatments carry unique severe hazards.
Right.
They classify these devices under an amber risk tier, which requires heavy oversight.
And their core argument isn't just some turf war about restricting access to doctors alone. They are advocating for systemic, proven competence. The regulatory framework relies on an approved core of knowledge training syllabus. It doesn't matter what your primary medical or aesthetic title is. If you don't possess a deep understanding of tissue absorption coefficients, thermal relaxation times, and how heat conducts through a metal shield, you simply should not be holding the device.
Because the mechanism that makes the laser so miraculously effective, its rapid energy absorption and immense heat generation, is the exact same mechanism that makes it a devastating weapon in the wrong hands.
Right.
The push is for protocols designed by expert registered healthcare professionals, ensuring a rigid safety framework surrounds every single pulse of energy delivered to the skin. You just have to respect the physics.
So mapping out the journey we've taken today, the technology really is astounding. We started with the sheer physics of a 10,600 nanometer beam of light, calibrated to target the water in human cells, instantly boiling it to vapor.
Yeah.
We moved through the extreme reality of fully ablative resurfacing, where the entire epidermal barrier is stripped away, and looked at the brilliant compromise of fractional lasers, operating like a controlled forest fire to accelerate healing.
We also examined the indispensable medical role of the CO2 laser, from bloodlessly coagulating tissue in podiatry to serving as a microscopic delivery system for vitiligo treatments.
And finally, We confronted the hidden, severe dangers of the operating room. From the reality of inhaling active viral DNA in the laser plume to the paradoxical, devastating risks of ocular injury and thermal burns through metal eye shields.
It constantly reinforces the absolute necessity of rigorous regulation and physics-level training for anyone operating these lasers.
It really does. But as we wrap up, I want to leave you with a final thought to mull over. We've spent this entire time looking at how lasers harness controlled destruction. We are literally inflicting calculated, microscopic thermal trauma to force the human body's immune system to rebuild tissue younger, tighter, and stronger.
It's an incredible exploitation of our biological wound healing response.
So where is the limit to the human body's regenerative capacity? I mean, if we can trick our skin into essentially reversing its own aging process simply by burning microscopic, precise holes into it, what other organs, what other internal biological systems might benefit from precise, calculated damage?
Understanding how trauma dictates regeneration is definitely one of the most fascinating frontiers in medicine right now.
Keep asking those questions, keep looking into the mechanics behind the medicine, and if you ever find yourself sitting in a clinic chair about to undergo a treatment, make sure you understand the physics of what's about to happen. And always verify that your practitioner is cooling down those eye shields, because that intense, precise beam of light has the power to reconstruct your tissue just as easily as it can permanently damage it.